Hello, my name is Spencer Tirey. I'm the Multimedia Manager for the Northwest Arkansas Democrat-Gazette. This is what I hope will be a continuing series that we'll do, revolving around nonprofits that help and work around our community. And to start off, we wanted to go into a little bit of detail about something that I think a lot of people don't realize. Arkansas is ranked 48th in its health care, 45th when it comes to prenatal. It's 47th in overall education. And on top of all of that, Arkansas also has one of the highest child poverty and food insecurities of any state in the nation. With the Arkansas legislative session just ending and discussions in Washington, D.C. about federal cuts, I thought I would sit down with the Northwest Arkansas Director of the Arkansas Advocacy for Children and Families and see what changes all of this will have on Arkansans. I called you because I wanted to kind of learn more about your organization and what you're doing because of the newsletters you guys sent out about the interesting thing on the budget cuts that are coming in from federal government. And I thought, you know what? I don't think a lot of people know your organization, one of the many nonprofits in the region, but you have a really specific focus, which is very interesting to me. And I thought maybe you could talk about it a little bit.
Sure. Yeah. I mean, in some ways, the title says it. It's Arkansas Advocates for Children and Families. So we're advocates for children. But there are a lot of ways to advocate for children, right? There are organizations that advocate, for example, directly for children in the foster care system, like CASA. There are children's advocacy centers where they do investigations of child abuse and neglect. But our advocacy is through the public policy process. So we want to change laws and policies in Arkansas in ways that make it better, make Arkansas a better place to grow up, make Arkansas a better place to raise a child. So we want to change laws and policies in ways that can improve opportunities for kids and their families. And in particular, we really focus in on the types of changes to laws that could help families whose incomes are low, children in poverty, children whose families live near at or near poverty. And so some of the examples that I could give could be, for example, could we be passing laws in Arkansas that would make it more affordable for a family to afford childcare? It's so expensive, as expensive or sometimes more expensive than going to college. Or could we pass laws and policies that would make it, make a mom be able to have a paid maternity leave? So when you think about the types of policies that we could be choosing to put in place in Arkansas, could we be really concentrating on how best to address children's needs and especially kids who may not have other opportunities? So our mission is specifically about making sure that all children and families have the opportunities that they need to grow up healthy and to meet their full potential. And so some examples over the years have been, legislation we got passed helped create the Our Kids First Children's Health Insurance Program, which is actually the insurer for almost half the kids in Arkansas. It depends on the year, about half the children have access to health care through that program. And then another well-known one is a pre-K program called Arkansas Better Chance, or ABC. So it's for a pre-K program for low-income kids who may not otherwise have a high-quality access to any kind of early childhood education before kindergarten. And so they can start out behind if they don't have access to that. So it's that kind of legislation. Like, what could we be looking at in Arkansas? Is it something that the state can afford? Is it something that we could get passed in our state? And that's the types of laws and policies so we directly lobby. I'm a lobbyist.
Right. Well, how are you finding like these basically holes in helping? Are you going to these other organizations that are trying to help, or are you just seeing legislation coming through?
All of the above, a whole variety of ways. We don't have any direct services to families, so we only work on public policy and research and collecting data about how kids are doing. And then we have just hundreds and hundreds of partner organizations throughout the state that do directly serve families. For example, they're the ones teaching those kids who are 3 and 4 year olds, or they're hospital who, may not be able to provide services to as many kids if we didn't have a program
Will
like
those organizations come to you and say, hey, we see a need here and we're trying to figure out how to meet it?
Sometimes, yes. I mean, I just got a call last week from, an organization in Northwest Arkansas that said, we need to talk. I think, there's something going on that I think it would be good for advocates to know about. I mean, we can't directly lobby for other organizations,
right,
but they bring us information that we otherwise wouldn't have, because we don't have families coming in the front door at Arkansas Advocates who we're serving directly. But those organizations do. So they see the challenges on the ground. And then another way that we, and then, you mentioned legislation that's already been filed. Like, should we be cheering for it to get passed, or should we be defending against it if we see that it could be harmful for kids? So both of those things happen all the time too. And then another way is we look at what is going on in other states. Are there states that, have much better success rate, higher grade level reading? They have lower infant mortality. Do they have more kids who have access to pre-K programs in other states? And what are they doing there that is helping kids and families succeed? And is it something that would work in Arkansas? So it's a kind of a combination of like needs we see directly on the ground, good ideas that we see happening in other states, and then reacting to legislation that we see filed by others, whether it be good or bad.
Do you work with other organizations outside of the state? Like, are there other states that have this type of organization?
Yes. Yeah. We're not part of any kind of national affiliate. We're not like an offshoot of a national organization, but we do have a lot of national partners and who fund organizations like ours in other states. The best example of that would be the Annie Casey Foundation that's based in Baltimore. They collect data from all of the U.S. states and territories about how kids are doing, and then help organizations like ours to identify what better policies could be. And so because there's one of an organization like ours that they fund in every state, we can work together with those organizations. I know, people like me in lots of other states who are working on some of the same issues, and we can learn from their successes and from their failures, and they can do the same with us.
How does your organization get its funding?
Sure. That's a good question, because I think there's sometimes a misunderstanding. We are completely privately funded. We have no government funding at all at the state or federal level, which is good and necessary. Right. We could not be an independent and credible organization talking about what policies to cheer on and what policies are bad if we weren't completely independent from government. And also, if we had government funding, that could be held as a threat over us, right? Like, you better be for this or against this because you have this government funding of some kind. And we're seeing that a lot right now. There are a lot of organizations right now that are under real threat because they're, especially at the federal level, cuts to grants and things like that are really hitting the bottom lines of organizations. And we need those organizations and the wonderful government-funded projects that they do, but we don't have any kind of government funding. So how we are able to keep our doors open is a lot of our funding comes from private foundations that understand that policy change is something that can make a huge difference. So there's an organization based out west that's called the David and Lucille Packard Foundation. So they, like the Hewlett-Packard, if you see HP on a computer, the P in that is Packard. And the David and Lucille Packard Foundation really cares about child and maternal health. And so they fund organizations like ours in several states to try to advance public policy to make sure that children have access to health insurance, that children grow up healthier, that moms are healthy before and after they have children. And so they see that as something that they want to really concentrate on. And they understand that if you can have success in a relatively poor state like Arkansas, you can really make a huge difference for children. In a state like ours, like I mentioned, Our Kids First children's health insurance program a minute ago, like I've run into people since I have worked at Advocates who tell me, I remember what it was like before our kids first. I remember when we would have a pie supper or a chili supper because a child, broke his leg on the playground and his parents were never going to be able to pay for the surgery that was necessary to, set his leg correctly. And we just don't.
Seems like this bar. You look at it now and you go,
right.
Yeah.
And we reduced the children's uninsured rate from 23% in Arkansas to about 5.5% today. And we had the biggest from the late 90s to now. We had the biggest reduction in the children's uninsured rate. In other words, we had the most success in getting kids insured of any state in America, and partly because we're a poor state, a relatively poor state. So we had a lot of kids
because I just looked at the statistics on Arkansas healthcare, and it was like 47th or 48th.
Oh, you mean in the overall?
Arkansas is ranked overall 48th state.
We that includes a lot of factors. We are actually pretty good on the percentage of kids who are insured.
Are we?
So that we have been as low as 4%. We saw some reduction we saw some, I guess, increase in the uninsured rate. In other words, fewer kids being insured because after the pandemic we had this big. It's probably more detailed than folks would want to know, but they changed. There was a change in the policy about how you would keep your health insurance, and so families had to fill out some paperwork to re-up. If you remember that happening a couple of years ago, and we had a really huge increase in the number of kids without health insurance. But we're seeing that families are coming back and getting signed up more over the past couple of years. But some of our the issues that we see in that, like, that contribute to that health number that you're talking about is, from our perspective, is some of the opportunities we're missing on maternal health. So making sure that moms stay healthy and that they have insurance. And we're seeing some changes in that. We saw some successes in the recent legislative session that we hope will make a difference over time. But some of those factors that lead to that low ranking include our infant mortality rate, our low rate of low birth weight babies. Our maternal mortality rate is one of the highest in the nation.
Yeah, I mean, we're ranked. It says Arkansas is ranked in paternal 45%, 45.
Yeah,
50.
And in maternal mortality, sometimes it's even higher than that. We've been 50th. We've been close to 50th.
Really?
Yeah, over the last few years. So it just depends on the ranking and what year it is, but we're definitely in the top few.
Why is that? I mean, what would be what's the factors that are going on in Arkansas that we're almost 50th?
Yeah, there are several factors. A lot of factors. I mean, a lot of it comes down to poverty.
Right.
So we are a relatively poor state, like many southern states.
Yeah.
We're a state that has had a long history of, I'm talking in the past decades of racist policies that created inequality, that have made it more difficult for families to have the economic opportunity, even, generations after, even now, that makes it harder for families to get to meet all the economic opportunity that they could have otherwise. And so there's several factors in the history there, but poverty really contributes to that, which contributes to the types of nutrition that you're able to have, to the types of health access that you're able to have. And in addition to that, we have not taken advantage of some opportunities that we could have in Arkansas to change policy that could improve moms' health.
Legislative session just ended. Mm-hmm. Any benefits that you got from the laws that they passed on that?
Yeah. Folks have probably heard a good bit about the Healthy Moms, Healthy Babies Act that passed this legislative session. That was a priority for Governor Sanders and the legislature. It came out of a study, a lot of folks who came together to say, okay, what could we be doing to lower that often highest in the nation maternal mortality rate? What could we be doing better? And so it included a whole bunch of different changes to state law that will be good. And it didn't include one of the priorities that we think it should have.
What priority was that?
Well, and I guess I could start with what was good. A couple of things that were good were priorities of ours, and one of them was a change to how moms are able to sign up for Medicaid. So, if you're talking about a low-income mom, Medicaid is often how she will have access to the prenatal care and then the delivery and the postpartum care that she needs. And so Medicaid is really a good way to make a change in mom's health, especially for women who are at risk of complications and they may not have access.
When you're saying sign up, it was just easier?
So basically you would, if you're pregnant and you go in and you sign up to get Medicaid coverage, you're like, I haven't had health insurance because I'm young and healthy and I don't have to worry about it. But I'm pregnant, so I better get some health insurance and I can't afford it otherwise. And I'm income eligible, and so I can go and sign up. They used to have to just wait like you or me would, and a person who's not pregnant come in, and you might have to wait weeks or months to get signed up and to get your eligibility paperwork. It's just a paperwork backlog thing. But now the state has changed through this law. There's a longtime priority of ours at Advocates. It basically fast tracks those moms. They can sign up. They can basically start getting prenatal care almost immediately. And then while the paperwork is happening over here, they are getting the care now.
No.
And then the paperwork can come later. And you kind of have to attest to a few things like my income is this and I'm an Arkansas citizen and these kind of things. And then you just get fast tracked is the best way to say it. The kind of the wonky term is called presumptive eligibility for pregnant women. It's presuming that you're eligible and now you get your prenatal care. And so that's going to help the baby. It's a great change to state law to help improve baby's health because they're getting that prenatal care faster. Help the moms, improve the mom's health too. So that was something that was really good. The legislation also included some improvements to policy that will allow doulas and midwives to have to be able to charge their services.
Did they not have part of that was they required them to register with the health department or something? Or
yes,
licensing or something like
that.
Right.
There was a certification that change for both doulas and midwives, and this is where I get into deep. Our health policy director and our health team in our Little Rock office are a lot more knowledgeable about that. But the big thing that it was missing was really low-hanging fruit that would have made a big difference in Arkansas, and that was every single state in the union that has Medicaid coverage for mom has extended the coverage so they would have coverage during the postpartum period. And ours only goes to 60 days, and we kick them off, and they have to sign up for some other health insurance while their baby's young and they're trying to juggle all this stuff. Every other state has recognized that that's not the best time for moms to have to re-sign up and find a new health care plan. But Arkansas has refused to change that policy.
Why? Why do you think that? I mean, maybe I'm putting you under the microscope here.
Right.
Why? What argument did they have to say we don't want to do this?
Right. I think that there was actually a little bit of confusion in the early years about how the state would be reimbursed for that. That there was actually a way that the state could get it's getting too deep in the weeds, but a better match rate for that than I think some folks realized. But then I think it became just something that we weren't going to do. But one of the reasons is that one of the stated reasons was that it was duplicative. That we have what's called a Medicaid expansion, so low-income people can have a different form of Medicaid besides pregnancy Medicaid, but the income levels for that are different, and we have other opportunities like through the Affordable Care Act. So they were trying to say there are alternatives for these moms, but there aren't alternatives for all the moms.
Right. And
also, almost every other state has those exact same alternatives. And so why are we making moms jump through these hoops when their baby's a month old to keep that coverage at 2 months? Why are we making them jump through hoops that other states? There was no good reason for it that we saw, and we'll keep insisting that until we run out of breath.
Do you run into I had a discussion with someone the other day, and you were talking about the different rates, different incomes, and we had this long discussion about the fact that so often these laws associated with trying to, like, health care and stuff like that for underprivileged, that it doesn't seem like legislators really understand the fact that you can set certain rates, but then when certain people reach certain thresholds, you take something away, and they end up going, hold it. When I make this much money, you immediately take this away, and I don't have enough money to go to the next stage of what I need to do to get myself out.
Sure.
And it's like it's this really juggling of not understanding that the pay rates are different.
And the term for that is called the benefits cliff, which is essentially you have this benefit and then you sort of fall off the cliff, and you might make $10 more a month, but you lose something that's going to cost you $1,000 more a month because it's health insurance or it's something else. And that there are a lot of good, smart people who are working on ways to smooth that. Mm-hmm. The state has established some policies over the years that do try to smooth that out in some programs. And so we're very concerned about that too. And there's some really good organizations that have been working on that. One here in Northwest Arkansas that has done a good job raising people's awareness about that issue is called Circles in Northwest Arkansas. That would be an interesting for you to put on your list of organizations to interview. But they're really good organization that fighting poverty, just like trying to help individual people get all the opportunities that they need, that they could obviously explain it better. But they have had some public forums and other things like that about the benefits cliff, and we've worked with them on that too. And I
need to do a podcast on that because I think it's very interesting. I think most people don't realize that.
Yeah.
The situation that goes on with that. So with all of this, so you said prenatal stuff was important. Was there anything else in the legislature that's in Arkansas legislature that you did well, that you thought you did well, and did something you didn't?
One that we cheered for, but that one of our partner organizations was the lead on was the universal school breakfast. I don't know if you've read about that, but that's probably the best thing to come out of the session for kids. Just like purely great.
That's for anyone.
Yeah.
Now. Yeah. That with my dealings with working with Tyson and everything, it was interesting because they were very much. I mean, I think they wanted that. To be part of their programs and stuff.
Arkansas has the highest. Arkansas has the highest food insecurity in the nation, according to the USDA.
It's the highest now.
U.S. Department, a couple of years now, the Department of Agriculture measures that
Feeding America
food insecurity. And folks like that, and so it basically means we have the highest hunger rate. Food insecurity is just another word.
Well, I think our percentage was like at one point when I was on the food bank board, I think it was 38 or something like that % of children in schools were food. I can't remember what the number. It was really high.
Across the state, in terms of the kids who qualify for free and reduced lunch, it's more in the low 60s.
Oh, is it really?
So it's 2/3.
I didn't want to say it, but I kept thinking it was like 51%.
Yeah, it depends on the school district, but statewide, it's typically in the neighborhood of, and I could be wrong about this number, but in the neighborhood of 65%.
Yeah.
Or 2/3 of kids in the state.
I'm not going to hold you to it because I don't have the number in front of me, so we can't really say we don't.
For free and reduced lunch, but a lot of kids are missed.
Right.
So kids whose families don't fill out the paperwork, or they otherwise are nervous about filling out the paperwork, or for whatever reason. But the great thing about universal school breakfast is all the kids who would have qualified are going to get school breakfast, and everyone else does too. And so that's going to catch those kids who might be right on the cusp of being, talk about a benefit cliff. It's going to catch those kids whose families might make just a little bit too high to qualify for free or reduced lunch. I mean,
one of the major things
breakfast, not lunch.
Said on that, and we're getting off topic for a second, but I'm just curious because you were sitting in the legislature when they did that. At the food bank, I remember when I was on the board that we saw the need because we needed to have the pantries because summer was so difficult for those families. Was there something in that related to? Are they having the breakfasts during off school?
That not in the state level legislation, but something that is really great that came out of the pandemic. We changed policy the nation changed policy during the pandemic to offer something that's called summer EBT, and it just means basically like SNAP for kids for the summer.
Oh, okay.
Food stamps for kids for the summer.
Yeah.
But it was, if you qualify for free or reduced lunch, we're going to give you an amount that will help your family afford food for that child in those summer months. And so I forget the exact number per child, and I'm not going to try to guess it, but per kid. But Arkansas is one of the states that takes advantage of that program. There are some governors who have just said, no, we're not going to continue to do that. The pandemic is over. We're not going to run a program like that. But to her credit, Governor Sanders has, for since it's been optional, has taken advantage of making sure that we offer that. So the family essentially gets what's an EBT card, which is like a food stamp card that makes up for that summer meals for those schools.
So they don't have to go to school or something. They can go to
they can buy what they want at the grocery store. They can buy what their family would need and want to prepare.
Well, that was one of the issues that we had. Yeah, it was that they didn't. A lot of them didn't cook.
Yeah,
a lot of them didn't. Yeah,
right. And it helps with culturally appropriate foods too, because you might, if you're a Marshallese family, you might not. You might reluctantly make what's in the box,
right.
But you might rather buy something else that's culturally appropriate for you. And so the good thing about the summer EBT program is it allows that, and it can be part of a whole, the family's whole budget for their food. But so it's not school breakfast and lunch in the summer, but it's trying to make up for that cost. And then there are other programs too that try that where kids can go in and get a meal, that's specific, like during the day as part of a program. But from our perspective, just like any and all of the above, please, if there are ways that we can keep kids fed in the summer. I work, speaking of being on boards, I'm on the board of EOA of Washington County, and it's over Head Start. And I would just hear some really, really tough stories at the beginning of the school year about kids who just very obviously hadn't eaten much
during the summer,
and how how different they looked, how hungry they were on that first day of school, how much they wanted to eat on that first day, and nothing pulls at your heartstrings more than a child who doesn't have enough to eat. So we're doing a good job of trying to take incremental steps in our state. And I can't remember if I mentioned the organization that worked really hard. I should have the Universal School Breakfast, but it's the Arkansas Hunger Relief Alliance. Yeah. They do a really good job of working on public policy that can help reduce child hunger.
Oh, good. Anything else from the legislature?
We had several priorities, some of which went through and some of which didn't. I could mention a couple of the ones that failed. We tried to eliminate fees and fines in the juvenile delinquency cases. Juvenile justice is one of the areas of work that we do at Advocates, but our juvenile justice system is set up in statute to rehabilitate. It's not supposed to be a punishment. It's supposed to be rehabilitation. And how can we make sure this kid isn't going to be someone who 10 years from now is in the prison system? Like, what can we do today to improve his life, his family, or her family's life? And so because it's supposed to be rehabilitative, the family shouldn't have to be paying for the whole program. It should be all of us who are paying for it to make it work, because we're better off in the long run if those kids,
don't get
succeed. Exactly. And so we've been trying to eliminate the fines and fees and make sure that, a child who gets in trouble, they have to pay restitution to their victims. Of course, that's something that they should have to do. But in terms of paying for the court system that then, quote, serves them, we don't think the kids and families should be the ones saddled with that debt. They end up with that. That failed. There was a really good piece of legislation that would have restored work certifications for 14 and 15-year-olds who work. I don't know if you remember, a couple of years ago, we rolled back child labor protections in Arkansas.
Yeah, I saw that on that list. Something about 10 employee that has more than 10 people need to give them pay stubs.
Oh, that one was a really good one by a partner of ours. But Arkansas does not have a requirement for anyone to have a pay stub. You don't have to have a pay stub.
So they don't know those kids are.
Yeah, and the reason for kids to have everyone should have a pay stub. But if we're certainly kids should be the highest priority to have a pay stub, because there are rules around how many hours they can work, whether they can work late at night or not. And if we're not following those for minors, having it on paper really helps. And that was just a real, just an egregious piece of egregious to let that fail. And
why do you think it failed? Was it?
I honestly don't know. It got through, and I'm going to get this wrong, I think, but I can't remember now if it got through the House and got stuck in the Senate, or I forget which side it was on. But I have it in my notes here. But I think it's typically things like that, and I can't speak for the people who voted against it, but typically the arguments can be not requiring a business to do one thing or the other. But if you have more than 10 employees and you're employing young people, then you should make sure that you're following the child labor laws. It was another way of protecting it. But a couple of years ago, we rolled back a child labor protection that required a work permit for employment certification for people who you hire who are under 16.
Right.
And that was a removal of a layer of protection for children.
So we don't have that anymore.
We don't have that anymore. And one of the good things about that certificate is it showed parents and kids that they had rights, because it said, for example, like, you can't work till close on to the school night. You can't work so many hours a day. You can't.
Are those still in effect, even though? The
rules are still in effect, but oftentimes families don't know that their kids have different different employment rules, and a lot of times it's fast food joints that are not following those. So we had a really interesting and well done report about child labor violations in Arkansas that came out last fall that people can find on our website at aradvocates.org. But you could just Google Arkansas Advocates Child Labor Report and you would find it. But it talked about how we have seen increases in child labor violations over the past, all across the country, but here in Arkansas too. Basically, we would have put that work certification back into place with a piece of legislation. And then there was another good one that would have just required more education for young people that they have rights. So maybe a poster in schools that says, if you're working, then, here's the rules that you're not supposed to be working until 1 a.m. on a Tuesday night, because education is supposed to be what we care the most about for kids. And we want every child to have the opportunity to work. I worked in a chicken plant when I was a teenager. We want kids to have the opportunity to work. Nobody's against work. Yeah. But what we want is...
Lifeguard.
But what we want is for kids to also, the priority is education and working too. It's a great experience for young people to work, but we just want to make sure families understand that there are rules around the hours that young people can work and that kind of thing.
So state legislature's done.
Yes.
And now you're dealing with some federal cuts that you guys are doing a special event on Tuesday, 13th at 5 o'clock?
5:30.
5:30 at the Jones Center.
Tuesday, May 13th at the Jones Center, 5:30 to 7. It might end earlier than that, but to call it a congressional town hall is kind of what we're calling it, to call attention to proposed really severe budget cuts that are being proposed in Congress right now.
And any specifics that you can talk about?
Sure.
Or other people can go there, but...
Yeah, of course. And the more people who know about these budget proposals, the better, whether they can come to the town hall or not. We would love to see a good crowd there on Tuesday, to show our members of Congress that a lot of people care about these issues, but we also understand that people have lots of things to do from 5:30 to 7 on a Tuesday night, take their kids to, activities, other things that they may have to do. But a couple of really big issues that we're concentrating on include there are budget proposals in the U.S. House of Representatives right now that would make severe cuts to the Medicaid program. We've talked a lot about Medicaid today and how important it is for low-income families. And, Arkansas is a relatively poor state, so Medicaid is even more important in Arkansas than in most states. And then more also severe cuts that are proposed on the SNAP program, which is Supplemental Nutrition Assistance Program,
Right.
Which used to be known as food stamps. And so these are, I mentioned before in our conversation before that we have the highest hunger rates in the nation. And so if Congress makes cuts to the SNAP program, it would hit us harder than most states. Again, we're a relatively poor state. So when you're looking at big cuts to Medicaid and SNAP, we're looking at big cuts for Arkansas families. We're looking directly at children in Arkansas having less food to eat.
I mean, I think Representative Bozeman is on the Agricultural Committee, and SNAPS is part of that, isn't it?
Yes. Senator John Bozeman, who's from here in Northwest Arkansas, he is chairman of the Senate Agriculture Committee, which has jurisdiction over SNAP. And so the U.S. House is the one that has these huge, really draconian cuts that they're proposing to SNAP. And we're encouraging House members not to vote for that. So all House members not to vote for that. But we also want to make sure that if they do pass that in the House, that the Senate doesn't do the same thing. And so we have talked to Senator Bozeman about this. We've talked to his staff about this. Please don't make these big cuts to SNAP, because it would have a huge impact on families in Arkansas. So that's one of the things that we'll be talking about on Tuesday.
So you have the cuts with Medicaid and SNAP. Anything else that?
We are trying to call attention to just lots of attacks on low-income families that are being proposed at the federal level. So another one, we'll have a speaker who's talking about Head Start and how we're worried that they're going to gut Head Start. And that's coming from right now from the executive branch. And also cuts to housing assistance. The president's budget that just was released last Friday would really make huge cuts to housing assistance programs. And this is at a time when housing costs are just really, really on the rise. And it's very difficult for families to afford rent, let alone to buy a house. And so we are very concerned about any kind of cuts that would hurt families who otherwise would have some kind of rental assistance that comes from the federal government. So there are a whole bunch of proposed cuts that are coming from DOJ, that are coming from the White House, that are coming from Congress. But the big push that we have is through this congressional budget process. We thought that we would see some very specific numbers and legislation about the proposed cuts to SNAP and Medicaid. We thought we would see those this week. So the week of May 5th, I'm not sure when people will watch this, but the week of May 5th, we thought we would see some specifics, but they actually haven't been able to come to agreement. And so we may not see some of the specifics until the day of the town hall or even later. We're not really sure. They've been delaying. We thought by now we would see. So right now, all we know is that in the House, the committee that has jurisdiction over Medicaid is being asked to cut $880 billion with a B from their budget. And it wouldn't be possible to do that without making huge cuts to Medicaid. It just wouldn't be possible to come up with that number without huge cuts to Medicaid. And then for SNAP, the House committee that has jurisdiction over SNAP, they're being asked to cut $230 billion with a B from their budget. And it would be impossible to do that without making big cuts to SNAP.
With the economy the way it is and Arkansas being at the level it is, would this not put a huge burden back on the state to fill this difference?
Right. That is a really, really good point, especially when for both Medicaid and SNAP. But SNAP right now is completely federally funded. The Arkansas budget doesn't have a line item for SNAP benefits to families. We pay just a tiny little bit of an administrative cost to make the program work, to take people's applications and to make sure that they're getting their SNAP benefits. But we don't pay the benefits at all at the state level. It's all federally funded. But one of the leaks that we've seen coming out of the House is that a proposal would be that a state like Arkansas would have to pay at least 10% of the cost of SNAP. Mm-hmm. And in Arkansas, that would look like $55 million a year. And Arkansas just doesn't, we don't see the state wanting to do that. And to tell you the truth, SNAP is an optional program. And so rather than pay $55 million a year at the state level, we would have major concerns that Arkansas would even keep SNAP. Would we even have a SNAP or food stamp program in Arkansas if we had to suddenly fork over $55 million to make it happen?
It's interesting you said that because we had Bart Hester in here a while back, and he had mentioned during a discussion about the legislature ending and stuff about the prison system, and that he thought that they had money available without doing it through the budget. The state had the money, and it's probably about 50 to 70 million that they were thinking, or even more. I don't remember what it was, but it sounds like they're going to have a bigger problem. When would this take effect? If these cuts occurred, how fast would something like that occur that the state's going to have to either go, what are we going to do? How are we going to, do you have any idea?
Well, it would be for the upcoming fiscal year, but to be honest, I would have to ask somebody else to help me with that, our economic policy director from Little Rock, to help me with the specifics on that question, exactly when the bill would come to Arkansas or the decision would come to Arkansas. I think that if they pass that change this summer, which is when we would see it probably become law and then the president sign it later in the summer, that it wouldn't take long for Arkansas to have to call an emergency legislative session to say, what are we going to do?
Yeah.
So we would see that. I mean,
apparently there's money in the system that's not being used because they're thinking about putting it somewhere else.
Right. And I don't want to assume that Arkansas wouldn't say, okay, fine, we'll do this and we'll pay for this. But a lot of states have a more generous SNAP program than we do. So maybe they've increased the income eligibility level in their state, or we have the most restrictions in place possible. Arkansas has just chosen as a policy to make it harder to sign up for SNAP and to make the hurdles as high as possible to get on SNAP. It's just been the political philosophy in Arkansas that we don't want people to be on SNAP, and so let's make it as hard as possible. So the poorest people are on SNAP, in other words. But because other states have a more generous program, if they were suddenly required to pay 10% or 15% of their SNAP program, in a state like, I'm just making up one, Michigan, that might have a more generous SNAP program than ours. So they could just make their program less generous, right? They could say, okay, we have to suddenly pay X million dollars. Let's make it more difficult.
Okay.
They could make up for they could take away some of that generosity, in other words, and use it to pay their share. But we don't have that in Arkansas. We have a bare bones.
Bare bones.
Yeah, we have a bare bones SNAP program. And to Senator Bozeman's credit, he, has said the same. That, Arkansas doesn't have.
Well, I do. He has a strong feeling toward it.
Yeah, he's done a lot of.
He feels strongly about it.
He's been a real advocate for hunger relief, and he's a really great listener. He listens to us and other advocates really talk about what the better policies that should be in place, and he has said very clearly that he doesn't want to see benefits cut to SNAP. And the same argument has been made on Medicaid too, that we don't want to see benefits to families cut. But what we do see is a bunch of proposals that eventually would make that happen, if that makes sense. They would take little policy changes, and over time that would mean it would be harder for hospitals to remain open. It would be harder for doctors to be able to take Medicaid patients. So the types of changes that they're proposing, we just want to make sure people understand something might just look like one little percentage point over here, but it could be a devastating cut to the program in Arkansas. If you don't mind, I'll give you one quick example of that.
Sure.
We have a Medicaid expansion in Arkansas. We're one of the few southern states that has chosen to do that. And what that means is we chose to cover low-income people 18 to 64 who, not non-children, non-elderly. I talk with my hands, knock everything around. We chose to do a Medicaid expansion to cover low-income people in Arkansas who are 18 to 64. And so a lot, 10...
Now, just as a baseline, when you mean low income, What's the income? Do you know the bracket?
I know the bracket. I know the percentage. What I don't have in front of me is what that means for like a family of 3.
Right.
I could get that to you if you wanted to put it in the notes or something. But it's 139% of poverty, so it's very low income. And I wish I had the
poverty number.
Yeah, I wish I had the what that would mean for a family of 3 in the back of my head, but I don't. But I can get that for you.
Right.
But it's pretty darn low income in Arkansas, and so that's who would qualify for the Medicaid expansion. So if you're a child, the income level is a little higher. If you're a pregnant woman, that income is a little higher level. But just for the Medicaid expansion population. So we chose to be one of the states that do that. And back during the Obamacare getting passed era, the feds were incentivizing states to establish a Medicaid expansion program. And so we have it. They pay more for it. Mm-hmm. It's a 90-10 match. So the feds pay 90%, Arkansas pays 10%. Right. And that's a high match rate for that specific program. So what we've seen is proposals in Congress to say, okay, well, let's knock that down. Maybe it would be an 80-20 match, or maybe it would be a 70-30 match for that program. So the feds wouldn't have to carry as much of the weight. States would have to pay more. But one thing that's very important for Arkansans to know is if that went down even 1 percentage point. So if the feds said, let's make it 89-11. So Arkansas pays 11%, feds pay 89%. Our Medicaid expansion program ends because it's written into state law that if it's ever lower than a 90-10 match, we don't have a Medicaid expansion anymore. And I think it's 11 other states like Arkansas whose Medicaid expansions would disappear, and that would be 300+ thousand Arkansans would lose their health insurance immediately, almost within a month, if the federal government changed that match rate. And so it's very, very important that people know, and it's one of the reasons for the town hall. We want people to know that what something might look pretty reasonable on paper at the federal level could actually mean 10% of Arkansans lose their health insurance.
10%.
Yeah, I mean, 300,000 Arkansans, we have 3.2 million people, or 3.3, something like that.
And would that affect, with something like that, 10%, and you're talking about, if you're mentioning earlier about hospitals and stuff shutting down, some of these rural hospitals require, basically a lot of their, I don't know a particular county, but a couple of them come to mind, that probably a large majority of their rural money for the hospitals come from Medicaid.
Yeah, and I can send you a study on that. I don't have it right, the percentages right in front of me, but Arkansas has a very high percentage of rural people on Medicaid as compared to other states. Mm-hmm. So when we talk about changes to Medicaid or possibly losing some Medicaid coverage, it would have a bigger impact in rural Arkansas than it would have almost anywhere in the nation. And that in turn would be the survivability of rural hospitals. And so we know that would have a huge impact in our state. We haven't seen rural hospitals closing like some other states have seen, right, because we're a poor state that chose to do it, very smartly chose, 10 plus years ago to do the Medicaid expansion. And that has really been a boon to our health.
I knew one of the biggest problems that some of the rural areas were having were just finding doctors.
Yes.
And I remember doing a whole piece on that.
Yeah, it's super complicated, more than could be just done with just, keeping Medicaid alive. The issue with attracting rural doctors, and I know it's very difficult, especially with maternal care in rural areas. It's been a very difficult and complicated, and I don't pretend to have the policy answers for that at all.
Yeah,
except that it wouldn't help at all to lose the Medicaid expansion. I know that for sure.
Yeah, that sounds like just one more thing being pulled. Yeah, that's gonna make a whole thing tumble. Anything else?
I don't think so. I think one thing you were maybe asking about, just like how could people get involved?
Yeah.
So people could obviously, engage in a public meeting like we're having on Tuesday through, a town hall. Also, people can just learn more about our organization at aradvocates.org. It's our website, and you can sign up to receive our newsletters and even legislative alerts. Sometimes when people really say, I really, really want to be kept up to date on these things, like if something's going to affect kids, a policy going to affect kids and families, please alert me. And so there are even people who, will make sure they know if their member of Congress is going to be making a vote tomorrow, or they're even a member of the legislature is going to be making an important vote tomorrow. So people can sign up for those kind of alerts. And then just, I mentioned that, we don't have any government funding or at the state or federal level. But one of the ways that people can support our work is just obviously donating directly to us. But we also have an event that I know you've been to before called Soup Sunday, and it is
fun. It's kind of I love that.
It basically pays for our Northwest Arkansas office to stay open. Right. We're a statewide organization based in Little Rock, and we opened a satellite office in Springdale in 2008, and that's where I work. And we would not be able to have an office in this part of the state if we didn't have Soup Sunday and if people didn't donate directly to keep this going. People think, okay, policy happens in Little Rock and in D.C., and then, Northwest Arkansas is supposedly rich. Why do we have to care about these issues in Northwest Arkansas? But here we have a lot of children who live in poverty. And
it's surprising. I mean, I know that I think a lot of people here, I remember a long time ago when I was on the food bank board, we would have people go, well, we don't have poverty here. We don't have food insecurity here. Mm-hmm. And it was like, yeah, no, you don't realize it's really high in the school.
Yeah.
I mean, Springdale alone, it's the largest school district in the state. And it's, I think, I keep 50 keeps coming in my head, but I keep thinking that's so high. But I think it was something that's just crazy.
Springdale's free and reduced lunch rate is much, much higher than that. So there's some schools that have to have it. It's higher than the state average. Even.
Oh yeah.
But like you say, because the sheer numbers. When we first opened an office here, one of my biggest jobs was just to tell people there are poor kids in Northwest Arkansas. Yeah. I mean, it sounds so obvious, but because forever we're just hearing about like poverty in the Arkansas Delta or poverty, in Southern Arkansas, and Northwest Arkansas is fine. And a part of a job, honestly, is to tell people in other parts of the state that everybody's not taken care of here in Northwest Arkansas. We do have low income kids. We have individual schools in Northwest Arkansas that have 98, 99% free and reduced lunch. So that's as high as anywhere in the state. So, and because we have bigger numbers, we have more kids in poverty in Benton County and Washington County than we do in the poorest, counties in the state.
And when I realized when I said Springdale,
mm-hmm.
I had a very interesting thing on Facebook a while back that it was like, somebody would go, oh, it's just Springdale. It's like, no, this is Bentonville, Rogers, that's Fayetteville too. Springdale, yes, has a stronger, but there's still a very large percentage in those schools as well that people just don't think about.
And if you have kids in the school, you see it.
Yeah.
There are kids in the classroom, and you understand like that these children don't have, the opportunities that your child has. And so all we're trying to say is that we want to make sure every child has the opportunity that they need, and that sometimes that is a direct charitable offering to a family. It might be a basket of food. It might be a coat that a child needs, to stay warm through the winter. All those are very, very good and necessary. But it might also mean a policy change that could really help thousands of kids at the same time have more opportunity, and that's where we come in.
When you deal with some of this stuff, do you also have to deal with the preconceived notions of how somebody would look at SNAP and go, well, you're just giving them candy and food. Or food stamps was always the thing. Well, they're just going out and getting candy and food. And it's like, well, yeah, but to a degree, that's the only thing they can afford through that program because it's so low.
Well, and there's a lot of misconceptions, and the biggest one on that one is I would just say that there have been plenty of studies that show that people who use SNAP buy, a sugary beverage or a piece of candy or a cake or whatever at the exact same rate as every other person in the grocery store. So they're not buying different things from you or me or someone paying cash. It's just, it's a different method of paying. And so we understand the argument on that, but where it comes in is the definitions. And so we want the state and federal government to be very careful about not making those definitions so narrow that someone who doesn't have a high quality grocery store near them, if it might just be Dollar General or Dollar Tree, near their house, making sure that they can still keep their kids fed with the foods that's available to them if they live in a food desert or if they don't have a grocery store near them.
Yeah, and it's amazing how food costs have gone up.
Yeah.
I mean, I just can't walk out of a grocery store now without paying. Absorb.
Yeah. Well, which is our biggest argument for let's not cut SNAP right now. We all are feeling it. Every single family in America feels higher food prices. So this is not the time to roll back a SNAP program or to make cuts to it or to make it where families can buy less food than they can today.
Well, thank you. I appreciate you coming and visiting with me, and hopefully we'll get this going soon. And good luck with everything that's going to be happening.
Thank you. I appreciate the time, and anyone who's interested in learning more about us can give me a shout or just check us out on our website. Again, it's aradvocates.org.
Thanks again.
All right. Thanks, Spitzer.
Take care.